Very good afternoon, everyone. My name is Dr. Sanesh Tateja, and I'm a consultant in arthroscopy and sports medicine at Fortis Hospital, Mulund. I'm here to talk to you about bone health and some cautions that you need to maintain while going through your fitness journey. Uh, Let me just pull up the slides for you. Right. Let's start at the very beginning. That bone actually is a living tissue that's constantly being replaced in the body. That is, it's undergoing damage and it is being then repaired. And this process, ये process जो इधर breakdown और repair होता है उसको remodeling बोलते हैं. Uh, एक और चीज रहता है कि bone is made up of mass and that mass is not static and it keeps changing. मतलब जैसे उम्र बढ़ती है bone का mass कम होते रहता है. Uh, और दूसरा चीज है कि एक ऑस्टियोपोरोसिस जो काफी चर्चा में है. इट्स अ वेरी कॉमन कंडीशन दीस डेज एंड ऑस्टियोपोरोसिस इज व्हेन द बोन becomes brittle. That means it becomes like grass. So imagine normal bone being like a plastic tissue where आपने थोड़ा bend किया उसको तो वो bend हो जाता है. Whereas if you try to bend glass, it fractures. So that's how the consistency of the bone changes in osteoporosis. And what this does is that it makes you liable for, or it makes a certain, increases the risk of a certain fractures like of the hip and of the spine. And overall, improving bone health also reduces your risk of osteoporosis. Now, why does bone health matter? Because good bones are required provide for providing support to your body. It helps you move. Uh, it avoids getting a fracture, and fractures can be very painful, and it can also cause a lot of debilitation and affect the quality of life. Uh, अच्छी गुड बोन हेल्थ रखने से आप अपना मोबिलिटी और फंक्शन एक इंक्रीज एज तक सपोर्ट कर पाते हैं. So the question is what are the key determinants? मतलब बोन हेल्थ हम कैसे क्या फैक्टर्स है जो बोन हेल्थ को मेंटेन करता है. सो सबसे इम्पोर्टेंट पॉइंट आता है इसमें न्यूट्रिशन का, वेर आप एडिक्वेट न्यूट्रिएंट्स सप्लाई कर रहे हैं बॉडी को जो बोन हेल्थ को इम्प्रूव कर सके. दूसरा चीज है फिजिकल एक्टिविटी. अभी आपने देखा रहेगा कि अगर एक एग्जांपल देता हूँ कि अगर एक बॉडी बिल्डर है जो बहुत ज्यादा जिसके मसल्स काफी बड़े हैं, अगर उसने 1 या 2 साल नहीं काम एक्सरसाइज किया तो मसल सब वापस छोटे हो जाते हैं. उसको हम एट्रोफी बोलते हैं. और ये होता है बिकॉज समथिंग सिमिलर ऐसे ही कुछ बोन्स में भी होता है जिधर अगर आपने बोन को यूज नहीं किया, ओके, या बोन पे ग्रेविटी का असर नहीं पड़ा तो वो भी उसका अपना मास खोने लगते हैं. ओके. बाकी डिटर्मिनेंट फैक्टर्स है तो फिजिकल एक्टिविटी उस हिसाब से इम्पोर्टेंट हो जाता है. दूसरा फैक्टर है कि जेनेटिक जो आपके जीन्स है वो एक डिटरमाइन करते हैं कि आपका बोन मास कितना है. और बाकी आपका जो लाइफस्टाइल है, स्मोकिंग, अल्कोहलिक हैबिट्स, ये सब भी मैटर करते हैं कि आप की बोन हेल्थ मेंटेन कर पाते हैं कि नहीं. अभी मेंटेन करने के लिए रेकमेंडेड क्या है? WHO बोलता है कि आपको 150 मिनट्स पर वीक एक्सरसाइज करना चाहिए. कौन से एंड व्हाई? बिकॉज एक्सरसाइज एक स्ट्रेच डालता है बोन्स पे और वो बोन को स्टिमुलेट करता है टू ग्रो. और कौन सा टाइप आप कोई भी ले सकते हैं, वॉकिंग, रनिंग, क्लाइंबिंग, और साथ में अगर वो अगर नहीं पसंद है आपको तो आप वेट ट्रेनिंग भी कर सकते हैं, रेजिस्टेंस ट्रेनिंग कर सकते हैं. उसके साथ ही साथ थोड़ा फ्लेक्सिबिलिटी इंप्रूव करने के लिए योगा एंड स्ट्रेचिंग कर सकते हैं. इसका इम्पोर्टेंस ये रहता है कि इंजरी प्रिवेंशन में मदद करता है और ऑल्सो आपका फॉल्स प्रिवेंट करता है क्योंकि स्टेबिलिटी ओवरऑल और बैलेंस बढ़ता है. ठीक है. अभी एक और इम्पोर्टेंट क्वेश्चन है कि आप अगर एक्सरसाइज रेगुलरली नहीं कर रहे हैं और आपको अभी एक एक्सरसाइज रेजिमेंट स्टार्ट करना है तो उसमें की स्टेप्स क्या रहते हैं? पहले मैं रिकमेंड करूंगा कि आप एक हेल्थ चेकअप जरूर कराइए. ठीक है. कभी कभी काफी सारे एक हेल्थ कंडीशन रहते हैं जो पिकअप नहीं होते, जो हमें पता नहीं चलते, जिनके वजह से या इंजरी हो सकता है या लाइफ को थ्रेट हो सकता है. सो मेक श्योर you get a health checkup before starting any new exercise routine. ठीक है. और एकदम से डोंट ट्राई एंड हिट मैक्सिमम इंटेंसिटी, इसको ग्रेजुअली बिल्डअप कीजिए, ठीक है, और रिकवरी पे फोकस कीजिए और हाइड्रेशन और न्यूट्रिशन पे फोकस कीजिए, ठीक है। अपना फिटनेस का जर्नी इज एक्चुअली अ साइकिल। तो आप देखिए तो करते क्या है, हम ट्रेन करते हैं, फिर हमें रेस्ट लगता है, दैट गिव्स द बॉडी एंड द मसल्स द अपॉर्चुनिटी टू रिकवर, ओके। एंड न्यूट्रिशन हम ये देते हैं कि टू हेल्प मेक योर मसल्स एंड बोन stronger. So ये एक perpetual cycle रहता है in your fitness journey. Certain precautions, what I generally recommend for all my patients or anyone who asks me for advice regarding to strength training, the first thing I would say is overtraining. Okay, this is when आप बहुत ज़्यादा कर रहे हो, you're overdoing things. Okay, for example, आप weight training कर रहे हैं और every day you're going to the gym and you're lifting weights. That is not ideal because your body needs, once you have done any form of exercise, आपके body को काफी trauma हुआ है. Your muscles have suffered small tears. Okay, your bones have suffered injuries. Also, they're like small fractures that happen on the bone, which the body takes care of by itself, by its normal healing mechanism. So if you are overtraining, आप रोज कुछ ट्रेन वो पार्ट को ट्रेन कर रहे हैं और रेस्ट नहीं दे रहे, तो ये रिपेयरिंग मैकेनिज्म ओवरवेल्म हो जाता है. ओवरवेल्म का मतलब है कि बिफोर जो प्रीवियस इंजरीज हील हुए, नए इंजरीज आ जाती है. ओके, एंड इससे हो सकते हैं स्ट्रेस फ्रैक्चर्स, मसल और टेंडन के टेयर्स या इन्फ्लेमेशन. ठीक है, तो लिसन टू योर बॉडी, रिकग्नाइज इट. अगर आपको मसल बहुत ज्यादा सोर है, so that is a sign that you are not supposed to exercise that muscle and you're supposed to rest it out. Similarly, अगर आपको बहुत ज्यादा fatigue लग रहा है, आपको लग रहा है your body is not able to handle an exercise, go easy that day. Nothing is going to change in a day's time. Alright? And along with that, pain. अगर pain कुछ भी कोई भी पार्ट का होता है, that is a very strong indicator that आप exercise ना करें. And if pain settle नहीं होता है, you need to see a doctor. Okay, so along with that, downtime is necessary. Where आप अगर आप बहुत टाइम से जिम कर रहे हैं, it is very obvious that you are going to have not just physical but mental fatigue. So if you want, you can also take a couple of days off, go for a trip. उसमें आप जिम वगैरह का मत सोचिए, एक्सरसाइज का मत सोचिए. It will just bring you back to the exercise routine with renewed energy. Right? And one more thing I recommend is that you आप अपना ट्रेनिंग या एक्सरसाइजेस का इंटेंसिटी डिफरेंट रखिए. ओके, बाय दैट आई मीन यू डोंट हैव टू do high intensity training every day. You can do a lot of combination of doing cardio someday, functional someday, strength training someday. You can mix and match and come up with a program. Okay, and you can discuss this with your trainer to who can then personalize this program for you. Okay. The other thing is using the proper form. Now the thing is when you are doing exercise, you are abnormally loading your muscles and your body and your bones because it is not used to. I mean, the body is generally used to what we call physiological load, जो हमारे routine activities में रहता है या फिर हमारे जो lower limbs में जो weight carry करते हैं हमारा वो रहता है. So what is important is that you have to maintain a proper form, okay, so that your muscles and your joint are not abnormally loaded, and this may cause injuries. Okay, so what are you supposed to do? First is that you have to ensure that आपका technique correct है, your body is properly aligned, okay, and your posture is correct. How do you do that? How do you ensure that? Well, obviously, it's not going to come first. First time you start exercising. So for newcomers, it is highly recommended that you seek guidance. You do these exercises under the guidance of a trained individual. If online is what you prefer, then you can probably look up some instructional videos, learn the techniques. Okay, observe or pay close attention to what proper possible errors that could occur, and then ensure that you don't repeat them when you are exercising. All right. The other thing to do is gradually progress. That means don't try and hit Mount Everest on day one. Okay, अगर आप running start कर रहे हैं, don't try to hit 10 kilometers in one day. You're going to unnecessarily strain your body. Okay, you're going to put a large amount of stress on your cardiovascular system, and your body is not used to that kind of stress. So it is a good idea to start with a small amount and then go by gradual increments. All right. उसके लिए avoid this all or nothing. मतलब ये आज मैं करके रहूंगा नहीं तो I am a failure. that is not the right attitude to have. Okay, अगर आप strength training कर रहे हैं, तो you'll see this after pretty commonly in the gym, what we call ego lifting, where you are not able to, you're not trained, you're not your body is not conditioned to lift X amount of weight, but you want to do this because it will satiate your ego. Okay, and this can result in catastrophic injuries. Uh, and because of social media, you see quite a lot of these injuries occurring in the gym these days, uh, because they just get uploaded, and they're accessible to you. So what my recommendation would be that both intensity and duration. Okay, you don't need to do a training for 1 hour on day one. Okay, you can start with just a 10-minute workout program, gradually build on it. All right, and uh, how and depending upon how your body is responding, gradually progress intensity and duration. Okay. Uh, Another thing is you keep your routine balanced. So this is another very common mistake where some people like to train their upper body more than their lower body. Right? So they'll be like, okay, I'll do chest one day, back one day, I'll do my arms one day, and then they don't pay attention to the rest of their body. Okay, uh, that that may probably enhance your looks in a way, but it's not necessarily best in terms of overall fitness and health. What this will do is जो आप अपने body parts को everyday और routinely train कर रहे हो उन पे strain आएगा, injury risk बढ़ेगा. Okay, as far as and along with that जो body parts को आप नहीं train कर रहे उनको वो neglect हो जाएंगे, वो muscles नहीं develop होंगे, and your body will go into an imbalance. Okay, so that is also another important thing to consider, that ये discuss कीजिए अपने trainer के साथ or with a friend who knows more about exercising, or you just look it up uh, on the internet. There are plenty of literature available, and devise your program to cover all bases. मतलब keep it well rounded. Okay, mix cardiovascular exercises with strength training, flexibility, functional. आपको जो भी combination अच्छा लगता है, but you make sure that you target almost every body part when you are exercising them routinely. The next thing I would like to mention is on nutrition. Okay, now generally इंसान का thought क्या रहता है, especially a newcomer, is that okay, I want to lose some weight, I'm going to go to the gym, okay, and I'm going to create a caloric deficit. तो वो acutely खाना बंद कर देते हैं. You switch from say 4 meals a day to say one meal a day. Quantity more than 50-60% कम कर देते हैं. You create a very large caloric deficit of say 1,000 calories. ठीक है, that is not healthy, because what is going to happen is that one, आपका जो एबिलिटी, आपको बॉडी को न्यूट्रिशन नहीं मिल रहा है, सो उनका उसका जो हीलिंग रिस्पॉन्स है वो कम हो जाएगा. सो योर रिकवरी वुड बी अफेक्टेड. बिकॉज ऑफ दैट यू विल नॉट बी एबल टू परफॉर्म ऑप्टिमली. अलॉन्ग विद दैट आपका इम्यूनिटी भी ड्रॉप हो जाएगा. ठीक है, अलॉन्ग विद this, what will happen is that eventually your body will try and adapt. Okay. See, so what will happen is that your body will start getting a message that, okay, I'm going to get only this much energy. And by default, the body is programmed to conserve energy. So how would it then go to energy conservation mode? By bringing down something called as a basic metabolic rate. Okay. And this occurs quite commonly, where people would start going on a crash diet. They'll lose an X amount of weight, and after say 3 or 4 weeks, they'll start to plateau off, and then they are like, I'm working so hard, I'm reducing my food intake, and yet I'm not losing weight. That is because your body is now adapted to and reduced its BMR. So how do you avoid that? Well, create a caloric deficit. There's no harm in doing that, but keep it very reasonable. Okay, so instead of creating a massive caloric deficit of 1,000 kilocalories per day, you can keep a minimal, like for 150 to 200. Okay, and that over days and weeks will have the desired result. But at the same time, it will ensure that your body is healthy. Okay, your muscles recover and grow, and you're able to get stronger. And it's not just a catabolic state that your body has reached. Catabolic means when it starts burning muscle. Okay. Along with that, maintain good amount of nutrition. So focus on what you are eating. So don't focus uh, on the quantity of the food, but rather the quality of the food. And does that meet your uh, dietary needs. Okay, and focus on both micro and macronutrients. And to that extent, I think it's a good idea to consult a dietitian and let them chart out a plan for you, so you can stick to that. Okay, and all bases are covered in terms of nutritional requirements of the body. Okay. I'll also include this bit for our audience who would be in the elderly group, and that is because osteoporosis is pretty common. If we're going into that, a very logical question that would be popping up would be, at my age, is it okay to work out? And the answer to that is absolutely yes. There is no age restriction. Obviously, you need to maintain caution. Okay, don't overdo. Keep it slow. Keep it easy. But exercise is also going to help you at any age. So there's no age limit to exercise. Uh, there's nothing that would say that exercising at a particular age will cause you any damage, but it is definitely going to help you improve your health. Okay. Now, one more thing that happens is that as you age, the absorptive capacity of the body goes down. Matlab, the body's ability to extract nutrition from your diet goes down. So what that means is that you may need some form of supplementation. And what are those? Well, routinely we are giving calcium and vitamin D supplementations. Okay, I've also mentioned the recommended dietary allowance and the source in details. Okay, but in case you want, you can also, I mean, or if needed, we can give supplementation in the form of tablets, and those are also effective. Another thing that you should be careful about is hydration, because what happens is that your body, when you're exercising, because of the raised metabolic activity, you tend to sweat a lot. Okay, and you're not just losing water in sweat, you're also losing salt. Most people you know of would hydrate with plain water. That is not going to replenish your salt. Okay, and this is then going to a trigger of cramps, or heat exhaustion or heat stroke, especially if you're working in a or exercising in a heated or hot environment. Okay, so be mindful of the environment and dress accordingly. So if it's a really hot place, don't try and wear appropriate athletic attire. Okay, and keep hydrating, not just with water but also with salts. Okay, you can either use a simple preparation like ORS. There are certain glucose preparations that come mixed with salt, and there are also commercially available energy drinks available. You can choose whatever suits you depending upon your preferences and budget, and all should be doing a similar job. Okay, now I need to mention this because this is again quite a hot topic these days. Uh, the knowledge on this can be very sketchy. There are a lot of people and a lot of so-called fitness enthusiasts online who claim to know a lot, and there are recommendations flying all over the place. Okay, and these can be really harmful. And so I would say that don't take any of supplementation without consulting your doctor. All right, all of them can cause some sort of harm if they are not used appropriately. All right. So I'll just go through some commonly used ones. I think the most common and the use of this particular supplement is exploded, and that is whey protein. So is whey protein safe? And the answer is relatively. When do you use it? Use whey protein only when there is excessive muscle breakdown. So if you are doing a lot of resistance training where you're breaking a lot of muscle fibers, or you're doing intense uh, endurance exercises, that is when whey proteins can be effective. Are they absolutely safe? No, there is evidence to suggest that there can be some sort of a liver issue with whey proteins. The evidence is contradictory, but in such a situation, I feel it is safest to maintain or observe caution. Okay, uh, creatine is another supplementation that has been, very vastly researched in the recent years. It's being very routinely used now, even by top level athletes. Uh, is it safe? Not in excess. Okay, you can use it in moderation. Okay, but you should also maintain gaps where you're off the supplementation. Okay, and you maintain this gap. in consultation with your doctor or your trainer. Okay. The but I would say that when you're using these supplements, make sure that you're getting yourself routinely checked. Okay, in the form of physical examination and your blood parameters. Uh, Another supplementation that is being commonly used is branched chain amino acids. They are relatively safe and there's no evidence for damage. I would still say that don't do anything in excess. Whatever form of nutrition you want is available in natural forms, and these are not absolutely necessary. You can cover all your protein requirements by having naturally available foods. Okay, in some situations, people need them and they can use them, but do maintain caution. The last bit is on injections of testosterone and gear that some of them use, and my sincere advice is stay clear of them. Okay, you may be looking good after taking them, but they are not building health and they are causing damage. So they are silently eating away your body. Okay, and they put you at an extreme risk of a serious damage that you could cause. So my sincere recommendation is stay absolutely clear of them. Okay, the next bit is to tie the two bits up where how do we maintain bone health by doing this by using exercise as a tool. Okay, now again I put it down as a chart. Okay, the key determinant is bone density. Okay, and another thing for our elderly is to screen people regularly to check if their bone density is less or they have osteoporosis. All right. If you think you do, speak to your healthcare professional. They can be tests that are done, and then it can be treated. All right. Right. I'll just skip over a couple of slides. Okay. Now, one more thing I need to mention about osteoporosis is that it tends to affect postmenopausal females more than the rest of the population. So they are the relatively important and target group for screening of osteoporosis. Having said that, elderly men are at a lower risk, but they are still at a risk of having osteoporosis. All right. So as I had mentioned earlier, it is a condition where the bones become brittle. Okay, and because they become brittle, they become more prone to fractures. All right. Other than women, people who are malnourished, people with certain medical conditions like rheumatoid arthritis and kidney disease, and people who are on steroids for medical uses. Please note these are not steroids that you use to build muscle mass. These are a different kind of steroids. All right. So these people are also at a risk of osteoporosis, and they need to be screened regularly. Okay. There are plenty of tests available these days. You can speak with your doctor, and they can and decide on the appropriate test for you. There are some strategies available for prevention and treatment of osteoporosis. So I've already touched upon supplementation exercise. Uh, Sun exposure would indirectly increase vitamin D production in your body, right? Avoid smoking because smoking is known to reduce bone mass. All right. So along with that, limit your alcohol intake. Okay, and if you think you are at a high risk, you can get a screening done and this treatment can be instituted. Now, I'm not going to dive into the details, but you can see there are plenty of medicines available. Okay, each have different forms of administration. It could be in the form of an oral pill or it could be in the form of an injection, and they're used depending upon the clinical setting. So it's not one size that fits all. Okay, it will have to be a decision that would be have to be made by your healthcare professional. Right. I thank you for your kind attention, and sorry. Are there any questions? So there's a question: special care to be taken in menopausal stage by gymmers. I would say that the only bit I would mention is that go a little slow. Just be mindful that uh, the body changes with age. Okay, and it's not going to be in terms of recovery. It's not going to be as quick as with a young person. But other than that, I would say just crack on whatever you are happy doing, whatever activities give you enjoyment. Go ahead and and perform those exercises. So what to do if bone density is low? I've already mentioned that you need to see a doctor, right? You need to assess how. So you need to assess how low is low. All right, so that is the degree of osteoporosis. Once that is become that is clear, you can then speak with your doctor, and they can start you on either a preventive strategy, or they can give you a treatment in the form of tablets or in the form of injections, depending upon the degree and your requirements. Are there any more questions? So we'll close the session for today. Thank you for your kind attention and have a nice day.